tired of that nagging back pain that just won't go away? Whether it's a dull ache or a sharp stabbing sensation, back pain can seriously impact your quality of life. But what if I told you that relief might be just a few exercises away? Today, we're exploring the best exercises for back pain. Simple, effective movements to strengthen your back, reduce pain, and help you get back to what you love. By the end of this video, you'll have a set of exercises to manage and prevent back pain naturally. Back pain is a common issue affecting millions worldwide, caused by factors like poor posture, muscle imbalances, stress, or certain medical conditions. While rest can help with acute pain, targeted exercises are crucial for managing and preventing chronic back pain. Understanding back pain. Before starting exercises, it's essential to understand back pain and why certain exercises work. The back's complex structure of bones, muscles, ligaments, and tendons supports the body and enables movement. When this balance is disrupted, due to weak muscles, tightness, or injury, back pain occurs. There are two main types of back pain. Acute back pain, sudden onset, usually short-lived, often from injury or strain. It can be sharp, but typically resolves with rest and care. Chronic back pain lasts 3 months or more, often harder to treat, linked to muscle imbalances, poor posture, or conditions like arthritis. Exercises that strengthen the core, improve flexibility, and enhance posture are key to alleviating and preventing back pain. Why exercise is important for back pain? Resting too much when your back hurts can worsen the problem by weakening the muscles that support your spine. Regular exercise, however, can strengthen the muscles, improve flexibility, enhance posture, boost circulation. Now, let's explore some of the best exercises you can do to relieve and prevent back pain. Remember, it's always a good idea to consult with a healthcare professional before starting any new exercise routine, especially if you have a history of back problems. Pelvic tilts. Pelvic tilts are a gentle exercise that helps strengthen your lower back and abdominal muscles while improving flexibility in your spine. How to do it? Lie on your back with your knees bent and feet flat on the floor, hip width apart. Relax your arms at your sides. Tighten your abdominal muscles and press your lower back into the floor. Hold this position for 5 seconds, then relax. Repeat 10 to 15 times. This exercise helps to engage your core and relieve tension in your lower back, making it a great starting point for anyone dealing with back pain. Cat-cow stretch. The cat-cow stretch is a yoga-inspired movement that increases flexibility in the spine and stretches the back muscles, relieving tension. How to do it? Start on your hands and knees in a tabletop position, with your hands directly under your shoulders and your knees under your hips. Inhale as you arch your back, dropping your belly towards the floor and lifting your head and tailbone towards the ceiling, cow position. Exhale as you round your back, tucking your chin to your chest and drawing your belly button towards your spine, cat position. Continue to flow between these two positions, inhaling into cow and exhaling into cat for 10 to 15 repetitions. The cat-cow stretch is excellent for increasing spinal mobility and warming up your back muscles, making it an ideal exercise for both morning routines and cool-downs after more intense workouts. Child's pose. Child's pose is a restorative yoga pose that gently stretches the lower back, hips, and thighs, providing relief from back pain and helping to reduce stress. How to do it? Start in a kneeling position with your big toes touching and knees spread wide apart. Sit back on your heels and extend your arms forward, lowering your chest towards the floor. Rest your forehead on the mat and relax your shoulders. Hold this position for 30 seconds to 1 minute, breathing deeply. Child's pose is a great way to release tension in the lower back and can be used as a resting position between more strenuous exercises. Bridge. The bridge exercise strengthens the glutes, hamstrings, and lower back muscles, helping to stabilize the spine and reduce lower back pain. How to do it? Lie on your back with your knees bent and feet flat on the floor, hip width apart. Place your arms at your sides with palms facing down. Press through your heels to lift your hips towards the ceiling, forming a straight line from your shoulders to your knees. Hold the position for 5 to 10 seconds, then slowly lower your hips back to the floor. Repeat 10 to 15 times. The bridge exercise not only strengthens your back and glutes, but also helps improve posture by engaging the muscles that support the spine. Knee to chest stretch. The knee to chest stretch is a simple exercise that stretches the lower back and can help relieve tension and pain in this area. How to do it? Lie on your back with your knees bent and feet flat on the floor. Bring one knee towards your chest, holding it with both hands. Keep your other foot flat on the floor, or extend the leg straight if comfortable. Hold the stretch for 15 to 30 seconds, then switch to the other leg. Repeat 2 to 3 times on each side. This stretch helps to lengthen the lower back muscles, providing relief from pain and discomfort caused by tightness or strain. Seated spinal twist. The seated spinal twist is a gentle exercise that stretches the spine, shoulders, and hips, promoting flexibility and easing back pain. How to do it? Sit on the floor with your legs extended straight in front of you. Bend your right knee and place your foot on the outside of your left thigh. Place your right hand behind you for support and your left elbow on the outside of your right knee. Gently twist your torso to the right, looking over your right shoulder. Hold the position for 15 to 30 seconds, then switch to the other side. Repeat 2 to 3 times on each side. The seated spinal twist is excellent for improving spinal flexibility and relieving tension in the back and shoulders. Cobra stretch. The cobra stretch, another yoga-inspired movement, strengthens the muscles of the lower back and opens up the chest and shoulders. How to do it? Lie face down on the floor with your legs extended and the tops of your feet resting on the floor. Place your hands under your shoulders, elbows close to your body. Inhale as you press through your palms to lift your chest off the floor, keeping your lower ribs on the mat. Hold the position for 15 to 30 seconds, then slowly lower back down. Repeat 5 to 10 times. The cobra stretch is beneficial for reducing lower back stiffness and strengthening the muscles that support your spine. Bird dog. The bird dog exercise strengthens the core, back, and hip muscles, improving stability and reducing the risk of back pain. How to do it? Start on your hands and knees in a tabletop position, with your hands directly under your shoulders and knees under your hips. Extend your right arm forward and your left leg straight back, keeping your hips level. Hold the position for a few seconds, then return to the starting position. Switch to the opposite arm and leg, extending your left arm and right leg. Repeat 10 to 15 times on each side. Bird dog is an excellent exercise for improving balance and coordination, while strengthening the muscles that support your spine. Hip flexor. Stretch tight hip flexors can contribute to lower back pain, and stretching these muscles can help alleviate discomfort. How to do it? Kneel on your right knee with your left foot in front, forming a 90-degree angle with your left knee. Place your hands on your hips or hold onto a chair for balance. Gently push your hips forward, feeling a stretch in the front of your right hip. Hold the position for 15 to 30 seconds, then switch to the other side. Repeat 2 to 3 times on each side. The hip flexor stretch helps release tension in the hips and lower back, making it a valuable addition to your exercise routine. Wall sits are an isometric exercise that strengthens the muscles of the lower back, glutes, and thighs, helping to stabilize the spine. How to do it? Stand with your back against a wall, feet shoulder width apart and about 2 feet away from the wall. Slowly slide down the wall until your knees are bent at a 90-degree angle, as if sitting in an invisible chair. Hold the position for 20 to 30 seconds, then slowly slide back up the wall. Repeat 5 to 10 times. Wall sits are excellent for building endurance in the muscles that support your back, reducing the risk of pain and injury. When to exercise and when to rest. It's important to note that while exercise can be incredibly beneficial for managing back pain, there are times when rest is necessary. If you experience acute back pain due to an injury, give your body time to heal before starting any exercise routine. Gradually introduce these exercises into your routine as your pain subsides, and always listen to your body. If an exercise causes pain, stop and consult with a healthcare professional. Alright, we've covered some of the best exercises you can do to relieve and prevent back pain. From strengthening your core and back muscles to improving flexibility and posture, these exercises can make a significant difference in how you feel. Remember, consistency is key. Incorporating these exercises into your daily routine can help you manage back pain and improve your overall quality of life. As always, be sure to consult with a healthcare professional before starting any new exercise program, especially if you have a history of back issues. Thank you for watching. If you found this video helpful, don't forget to give it a thumbs up, share it with others who might benefit, and hit that subscribe button for more health and wellness content. Here's to a stronger, pain-free back.